I'm lifestyle medicine cardiologist Dr. Steven Lome, and in this video, I'm going to tell you how you can not only prevent heart disease, but even reverse it right now. Many people don't realize how preventable heart disease truly is. It's nearly 100% preventable and even reversible in a vast majority of cases. For you to understand how it is that we prevent and reverse heart disease, first, you need to know why it is that we clog our arteries. The term atherosclerosis is broken into two different parts. Athero actually means porridge, and sclerosis means scarring. So our arteries literally scar up with this cheesy, gooey, sticky substance, and I do think it looks like cheese. It starts early. The day you're born, your arteries may be nice and clean, but as young as the age of 3, you start developing fatty streaks. Into adulthood, it grows, and eventually you develop advanced disease. When a blood clot suddenly forms inside one of the arteries on top of a cholesterol plaque, it can cut off the blood supply and trigger a heart attack. The first symptom in 1 out of 3 people with heart disease is actually sudden death. Heart disease, they say, has been the #1 cause of death in America for more than 100 years in a row, with 600,000 Americans dying every year from this disease. And putting it in perspective, heart disease and stroke is huge in proportion to other causes of death such as war, pregnancy and birth complications, murder, and suicide. So why is it that we clog our arteries then? Why are we getting this yellow, gooey, sticky substance that keeps building up? Well, I like to explain it this way. The default state of the human body is actually to be healthy. The arteries don't want to clog. They only clog if we actively do something to damage them, right? So we don't want to damage our arteries. Let's think about animals out in nature. Monkeys out in nature eating bananas, they're physically active. They don't smoke cigarettes to damage their arteries. And rabbits, similarly, they eat their carrots, they're physically active, and they don't smoke cigarettes. And guess what they don't do? They don't clog their arteries at all out in nature. However, if you change their diet to one high in cholesterol and saturated fat, or do other things that damage their arteries, you can induce clogging of these animals very, very, very quick. Now, I don't endorse animal experimentation whatsoever. However, the science clearly shows this. But it's even crazier, because if you take these animals after you clog them up and you put them back into nature, give them back their bananas and carrots, guess what happens? Their bodies heal themselves up. They reverse their disease. If you just take away the thing that's causing the harm to the arteries, then the disease can reverse itself. So let me show you how exactly that works. The two things that you need to worry about is getting your blood cholesterols crazy low and protecting your arteries from damage at all costs. So let's get into it. There was a good article titled "It's the Cholesterol Stupid" from the editor of the American Journal of Cardiology, pointing out 4 reasons why cholesterol is so important for your arteries. Atherosclerotic plaque, the clogging of arteries, is actually produced in herbivores just by feeding them cholesterol and saturated fat. That's number 1. Number 2, there's actually cholesterol in the plaque. The cholesterol makes up the majority of the plaque. Number 3, cultures and societies where blood cholesterol levels are crazy high, they have a huge rate of heart disease and stroke, and they just have overall more plaque. And number 4, if we take people and we lower their cholesterol levels, the frequency of artery clogging, heart attacks, and strokes goes way down. So the cholesterol is one of the most important things that we need to focus on. He actually said straight out that perhaps having high blood cholesterol levels is the only major risk factor for clogging your arteries, for developing atherosclerosis. Meaning, as long as your total cholesterol is really low and your LDL cholesterol is really low, there's no evidence that smoking cigarettes, high blood pressure, diabetes, being physically inactive, or obese is going to clog your arteries. You could be a smoking, obese, diabetic couch potato, and if your blood cholesterol levels are low, it's likely that you're not going to clog your arteries. So the standard cholesterol numbers that you always hear is a total under 200, an LDL under 100, the HDL cholesterol should be greater than 50, and triglycerides should be less than 150. However, what's crazy is in the Framingham study, 35% of heart attack patients had total cholesterols between 150 and 200, considered in the normal range. So maybe that's not really the normal range. Maybe we should push it even lower. This publication, called "Impact of Lipids on Cardiovascular Health" in 2018 in the Journal of the American College of Cardiology, showed it really well in this graph. On the bottom, we have our age. And we are assuming that this middle line here is somebody with an LDL of 125. LDL cholesterol of 125. That's the average LDL in America, actually. If you had your LDL of 125 by the age of 40, you're going to have a 1% risk of having had a heart attack. By the age of 60, it's 4%. And by the age of 80, it's 16%. And LDL of 125, a lot of people just kind of blow that off and think that's not too high. But look, it puts you at significant risk. Now, what if your LDL was even higher and it averaged 160 from the day you were born? Then by the age of 40, your risk is 3%. By the age of 60, it's 16%. And you're off the charts at the age of 80. Now, if you're able to get your cholesterol really low from a very, very young age, say as low as 60, by the age of 40, your risk isn't even 1%. By the age of 60, again, it's not even 1%. And by the age of 80, you still don't have a 1% risk. So getting your LDL cholesterol as low as you can from a very, very young age is what's going to protect your arteries from clogging up in the first place. More and more evidence from multiple different sources are consistently demonstrating that the physiologic normal level of LDL cholesterol is between 50 and 70. When you look at babies, it's between 30 and 70. And when you look at primates out in nature, the LDL is between 40 and 80. So perhaps that's where we should be. So this is actually a graph of what we call primary prevention trials. Each one of these dots here represents thousands of patients in primary prevention, trying to prevent the first heart attack, the first stroke, the first aneurysm, the first bypass surgery. And here on this line, we have our LDL cholesterol. And on this side, we have heart attack, stroke, cardiovascular events. And what you'll see is when you graph this out, where do you need to get your cardiovascular events to 0% risk? And that is actually an LDL cholesterol around 55, specifically 57 is where the event rates will approach 0. What if you already have cardiovascular disease? This is a very similar graph where each dot is a clinical trial, but this is for secondary prevention. So these are thousands of patients that already had cardiovascular disease and looking at their LDL cholesterol levels. It needs to reach 30 for event rates to approach 0 in this situation. So we really want to drive that LDL cholesterol down as low as we possibly can. Maybe our ideal cholesterol number should really be a total cholesterol of less than 150 and an LDL cholesterol of less than 70. Don't worry about HDL, that's a topic for a different video, and triglycerides as well. So how can we drive our LDL cholesterol really, really low to protect our arteries from clogging? Well, there's three main dietary factors that actually raise your LDL up significantly, and here they are: dietary cholesterol, saturated fat, and trans fats. Which diet eliminates all dietary cholesterol, essentially all saturated fats, and essentially all trans fats? Only a whole food plant-based diet. And a whole food plant-based diet is the only one that's ever been shown to reverse heart disease. So that's what we need to focus on. To make nutrition simple, let's just say there are only 3 food groups that we need to worry about. Food group number 1 is processed junk food. Cookies, crackers, cakes, donuts, soda pop, all those things that we know we shouldn't be eating. But we also need to put in the processed food category the bad carbohydrates. White flour, white rice, white bread. They always say the whiter the bread, the sooner you're dead, right? And sugar is considered a refined carbohydrate. These are bad carbohydrates. Now, we need to keep in mind that all the longest living cultures in the world were high carbohydrate diets. So don't say all carbohydrates are bad. We can't say carbs are bad. Bad carbs are bad, and these are the bad carbohydrates. But good carbs from fruits and vegetables and beans and whole grains, those are very good for you. But also in the processed food category, we need to include oils. Oil of any kind is concentrated fat. Even olive oil is 15% saturated fat. We should be eliminating oils from our diet as well. That's a topic for a different video. The second category is animal-based foods, meat, eggs, dairy, and seafood. And the third category is whole, unprocessed, plant-based foods. There's more than 100,000 edible species that you can eat in the whole plant food category. So dietary cholesterol is only found in animal-based foods: beef, pork, poultry, fish, seafood, eggs, and dairy products. There is no dietary cholesterol in any plant-based food: fruits and vegetables, beans, grains, nuts, and seeds. There's a lot of fiber in plant foods. There is no fiber in animal-based foods. When you look at what actually has cholesterol in it per 100 grams of the food, chicken ends up being the #1 source of cholesterol in the American diet. Now, a lot of people think, I thought chicken was healthy for me. I eat a lot of chicken. I thought it was way better than eating red meat. Well, if you look at the dietary cholesterol component of chicken versus red meat, there's really not that much of a difference. Now, when you look at egg yolk per 100 grams, it's got a crazy amount of cholesterol in it. Eggs are actually the #2 source of cholesterol in the American diet in most surveys. Looking at the whole egg, when you include the whites in it, there's still quite a bit of cholesterol. Butter is very high in cholesterol, but look at plant foods. There is no cholesterol in any plant-based food. So should we eat any cholesterol to live? We don't need to eat any cholesterol at all. Our liver can make it for us. Actually, every cell in our body can make cholesterol, so we don't need to have any from our diet whatsoever. According to the USDA dietary guidelines, we should eat as little cholesterol as possible while consuming a healthy eating pattern. Now let's talk about saturated fat. The bad saturated fats drive up our LDL cholesterol levels, so we want them to be crazy low. Here are the foods that have a lot of different saturated fats in them. Butter is very high in saturated fat. Cheese is the #1 source of saturated fat in the American diet. And again, I'm still convinced that the reason I have a job is cheese, because the arteries itself, when they clog, it looks like a cheesy, gooey substance. Red meat is very high in saturated fat, and white meat is a little bit lower. This is why white meat is thought to be healthier than red meat. But remember, the dietary cholesterol component of the white meat is still very high, and there is still some saturated fat in white meat. So just because the white meat is less toxic for you, less bad for you, doesn't mean it's healthy for you. It just means it's less toxic, right? And when you look at oils, they can have quite a bit of saturated fat in them. However, whole plant foods have essentially no saturated fat. So is there any safe amount of trans fats, saturated fats, and cholesterol that we could eat? According to the USDA dietary guidelines, the Institute of Medicine did not set an upper limit for trans fats, saturated fats, or cholesterol because any intake above 0% of energy increased the LDL cholesterol levels any little bit. So you want to avoid eating any dietary cholesterol. You want to avoid eating any saturated fat or any trans fats at all in order to keep your LDL cholesterol as low as you possibly can. Just like cigarettes, right? You don't need to smoke cigarettes to live. They don't say you can smoke 5 cigarettes a day or 2 cigarettes a day. No, it should be 0 because any cigarette smoking can induce harm. So now let's move away from the blood cholesterol talk and let's get into protecting our arteries from damage. The lining of the arteries is called the endothelium. It's a single cell layer, and we don't want it to become damaged at all. Clogging of arteries is actually an inflammatory process. And if you look at the word inflammation, it literally means inflame. So think of our arteries as like being on fire, right? We don't want to do anything that pours gas on the fire. We don't want to fuel the flame. What things fuel the flame? Animal products, processed oils, the bad carbohydrates, even caffeine causes dysfunction of the endothelium, saturated fats, and other toxic exposures like tobacco and secondhand smoke. Well, what pours water on the fire? Fruits and vegetables, beans, lentils, whole grains, herbs and spices, over 100,000 edible plant species that you can have. Now, our concept in medicine is always that the human body is imperfect, that we need a supplement or a pill. We need to put a stent in the coronary artery or a bypass surgery to fix the clogging, when really, if we just remove the thing that's causing the harm, as you will see in this analogy, the fire will go out. The default state of the human body is to be healthy. We just need to give it the chance to heal. So remove the things causing the inflammation and the harm. Only consume the things that are pouring water on that fire, that are helping to heal up the arteries, and we can reverse heart disease. So get your blood cholesterol LDL levels crazy low and protect your arteries from damage at all costs. Protect that endothelium. Don't allow that inflammation to happen. That's how you can prevent and even reverse heart disease. So now I'm going to show you some of the data, some of the research that we did in humans to show that this actually works very well. First, it started with one of the founding fathers of lifestyle medicine, Nathan Pritikin. His statement was all he's trying to do is wipe out heart disease, diabetes, hypertension, and obesity. He had severe heart disease in his 40s and changed himself to a plant-based diet, and his angina went away. He said he wanted his autopsy to be published in the New England Journal of Medicine when he died, and it was, showing the near absence of atherosclerosis and the complete absence of its effects, which were remarkable. Then Dr. Dean Ornish published a lifestyle heart trial in 1990, clearly showing that we can actually reverse heart disease when you use a whole food plant-based diet and other lifestyle measures such as exercise, stress relief, yoga, and it worked very, very well. The control group that did not follow his plan actually progressed their heart disease. It became worse. And at 1 year follow-up, it was very, very solid data. He even showed the same thing happened after 5 years, and more regression occurred when you continued on this plan over time. And it makes sense that it takes decades to clog the arteries. It's not going to reverse completely within just 1 year or 5 years, but as you keep going, you get more and more regression and the body heals itself more and more. Dr. Caldwell Esselstyn of the Cleveland Clinic did similar data with smaller numbers of people, but still showed reversal of heart disease. He subsequently followed this up with a larger series of patients, which showed that plant-based nutrition had a major impact. The event rate of heart attack, stroke, and dying from cardiovascular disease was crazy low if you followed his dietary plan, which is whole food, plant-based, no oil. Whereas if you did not stick to it, the event rate was very high. If you look at these scans here, you'll see this is a stress test on the left, and you'll see a big blockage here. The blood flow is severely limited, but with only 3 weeks of a whole food plant-based diet, the blood flow nearly normalizes. Inflammation goes down, the clogging starts to reverse itself, the very small microvascular vessels open up. And on the right is actually a case report of a 40-year-old surgeon who had severe heart disease, and with only changing their diet, reversed it over a couple-year time period. So the new guidelines for primary prevention of cardiovascular disease from the American College of Cardiology and the American Heart Association do now recommend a plant-based diet as one of the main dietary approaches to prevent heart disease in the first place. And the data when you already have heart disease is even stronger. And here's the bonus. It's not just heart disease that you're going to be getting rid of here. You're also going to prevent many other lifestyle-related diseases, and you can even reverse many of these as well. These are all best treated with the lifestyle medicine approach. Of course, heart disease, but also stroke, hypertension, diabetes, obesity, high cholesterol levels, of course, and peripheral arterial disease. Many different types of cancers, autoimmune diseases, arthritis, including rheumatoid arthritis, neurodegenerative diseases like Parkinson's and Alzheimer's, osteoporosis, and sleep apnea. These different diseases are not really different diseases. They're just simply different manifestations of the same disease, which all relate to a poor diet and a poor lifestyle, so they should all be treated exactly the same. So some people may be thinking, man, a whole food plant-based diet, that sounds kind of extreme to me, right? Well, let me ask you this question. What sounds more extreme, changing to a whole food plant-based diet, or taking a saw and sawing somebody's chest open, taking veins out of their legs, rerouting the blood supply, doing an open heart bypass surgery like 500,000 Americans get every single year, which does nothing to treat the cause of the person's problem. Has a 3% risk of dying as a complication, a 3% risk of stroke as a complication of the bypass surgery. Oh, and by the way, it only lasts 10 years before most of the bypass will fail. That sounds kind of extreme to me. Changing to a whole food plant-based diet sounds like a much better option in my opinion. You need to watch the documentary Forks Over Knives on Netflix. There's another great one called Eating You Alive. If you go to eatingyoualive.com, this will open your eyes. Great books to read. How Not to Die by Dr. Michael Greger, and The China Study by T. Colin Campbell. Prevent and Reverse Heart Disease by Dr. Caldwell Esselstyn is a very important read and very quick and easy. There are so many different recipes you can find too. The websites are all over the place in regards to the food. And there is so much food that you could eat when you're eating this way. You could still have everything that you've had on your prior diet, just in a whole plant food version of it. The food is spectacular. It makes you feel full, gives you all the nutrients you need. Now, many of you may be thinking, geez, am I going to get all of my macronutrients and micronutrients on a diet like this, excluding all animal products and all processed foods? Where's my protein coming from? What about all my vitamins and minerals? Well, according to the American Academy of Nutrition and Dietetics, a well-balanced plant-based diet is nutritionally adequate for all stages of life, including pregnancy, infancy, adolescence, adulthood, and in the elderly. So you get all the nutrients that you need. And actually, when you're eating a whole food plant-based diet, not only do you get all the macronutrients like protein that you need and all the micronutrients like vitamins and minerals that you need, but you don't get any harmful components that come as baggage when you eat animal-based foods and processed foods like dietary cholesterol and saturated fats. So you want to be eating whole food plant-based, a good variety. So I hope you liked this video on preventing and reversing heart disease. Let me know what you think. Give me a comment below. Click that like button if you liked the video and subscribe to my channel so you're notified of all future videos that I put out. My social media links are in the description below, as well as the links to all the different recipe websites and the documentaries and books that are very, very important for you to check out in order for you to prevent and reverse heart disease. Now stay tuned. Part 2 of this is going to actually be some of the more detailed nuances of how you can prevent and reverse heart disease. See you next time.